Hello, everyone. Welcome back to The Political Patient. My name is Anusha, and that is Shreyas over there. And today we're going to be talking about the Affordable Care Act. Why we're talking about an act that's been passed a couple of years ago? Well, a record 13.6 million Americans have signed up for health coverage in 2022 as of approximately 6 days ago, so about a week. The Biden administration just actually announced this, and they are saying that this is because of increased government subsidies, lowered out-of-pocket costs, and just a general surge in enrollment. And you can actually see that what is interesting is they've been having the largest increases in states like Florida, Texas, Georgia, and 9 other states, all of whom have not expanded Medicaid under the Affordable Care Act, which is why this is also making a lot of headlines too. You'll see that, for example, in states like Georgia, they've had enrollment jump from like 514,000, I believe, Shreyas, to like 653,000 approximately, give or take, which is incredible. The executive director of the Georgians for a Healthy Future, which is a consumer advocacy group, have been saying that this is one of the biggest jumps in enrollment. Similarly, Texas had a jump from 1.4 million to 1.7 million. However, people have been contentious about it, have been saying that, of course, for example, our representative for Republican Governor Brian Kemp has been saying that the strategy by the government is a not so great strategy, and just because people are enrolling does not necessarily mean that this is a perfect one size fits all strategy. In general, the Biden administration is still reviewing proposals by states to refurbish or kind of revamp Medicare for all or these kinds of plans that are currently present in the states. But yeah, Shreyas, what do you think about what's going on?
Yeah, it's definitely very interesting and also complicated because um, other than the big enrollment that we saw in 2016 at the
Mhm.
end of President Obama's second term, um, this is like the next big spike, I guess, in enrollment for the Affordable Care Act, like in their marketplaces, because not much has happened in President Trump's administration, because he did cut out a lot of funding for something called navigators, who are the individuals that would be helping people sign up for the coverage in the first place.
Mhm.
But on top of that, it really just goes to show how state decisions can sort of have a huge impact, even if it's like inadvertently on the federal level. Like for example, like the states that have seen the biggest increases in enrollment in the ACA are like Anusha mentioned, Florida, Texas, Georgia, and these states did not expand Medicaid under the Affordable Care Act. So individuals might be just signing up for the Affordable Care Act simply like, or the coverage that comes with it, simply because they do need it, but their states have not done enough. And this
Mhm.
just also connects to how there's been an increase in like the need for health insurance and just healthcare over the past couple of years with the COVID-19 pandemic, and this might just be a result of that and like the Omicron variant that's out here. And it also, President Biden recently said that changes and initiatives at the state levels may be more beneficial than like initiatives at the federal level. But this just sort of connects to that because this is a federal initiative and it seems to be helping people, but it's also in response to some state level initiatives or the lack thereof. So again, just this gets to that whole state versus national debate that we consistently have.
Yeah, absolutely. I think it's very hard, especially in a country like the United States, which basically has its own like independent, like 50 little countries, if you really think about it, to kind of work together and create a plan that works. And in some cases it works really well, and sometimes it doesn't. And people have their opinions as to whether or not the Affordable Care Act is, an example of whether it's a success or a failure, right? But going back to like what you were talking about, navigators and like the increase in enrollment, it's actually pretty interesting because they were saying that, especially in the non-expansion states, there's been a huge increase in outreach efforts. So, for example, the federal government has been using 4 times the number of navigators, otherwise known as like insurance counselors, to help people sign up for insurance. That's directly coming from the Secretary of the U.S. Department for Health and Human Services. Additionally, they think that a huge driver behind these enrollment gains, Shreyas, is these new discounts on premiums. So we're seeing that as part of a relief bill passed this year, actually in 2021, Congress increased the subsidies consumers receive when they enroll in health insurance. And so we're seeing that, for example, like 92% of the people currently will get tax credits for 2022 coverage. But of course, everything has its detractors, and a lot of conservatives have been saying that these higher subsidies just simply mean the federal government is paying more for monthly insurance premiums, and all it's really doing is the only big winners in their opinion here, at least, is that health insurance companies are just getting billions of dollars in additional government subsidies. And like you said, a lot of people might have lost job-based coverage during the pandemic, and so they're probably trying to get their own independent and individual insurance.
Yeah, and like I know that many individuals are not a fan of the ACA health insurance program, and just how it's not real, like a one size fits all sort of solution cannot work for everyone. But this just really emphasizes that people need healthcare coverage,
Mhm.
but on top of that, are actively seeking it right now for a variety of reasons, like you just mentioned, like people perhaps like not being able to rely on the health insurance that they previously had because of job changes or unemployment and
Mhm.
things like that during the pandemic, which is still ongoing, as we know. But there does need to be, we need to focus attention onto this for sure. Yeah.
Absolutely. Healthcare has always been an issue in this country. I think Shreyas and I are both definitely of the opinion that the right to protect your own health and therefore, have your own healthcare is something that's universal. Like we don't get to pick and choose that right. It is a right after all. How and where and when you get to fulfill that right and how the government and states make sure that you fulfill that right is still very contentious to this day. Like Shreya said, ACA is either very popular, unpopular, and the vast majority of people I feel like have no idea what the act even is and what it still does, even with these health articles and like a bunch of news coverage just on the act itself have been coming out recently.
Agreed. Well, thank you everyone for listening to today's episode of The Political Patient and hearing us talk a little bit about the Affordable Care Act and how it's once again very relevant today.